Hello everyone, I am Lina from Hematological Department of First Affiliated Hospital of China Medical University. Nice to meet you. It's a great honor for me to study hemolytic anemia with you together today. Now, let's get started. First of all, we will talk about the general theory of hemolytic anemia, about the definition, classification, and manifestation of hemolytic anemia. Hemolytic anemia refers to increased destruction of red blood cells by various types of causes that exceed the compensation from bone marrow. Bone marrow has 6 to 8 times the compensatory potential of erythropoiesis. If there are increased destruction, but the bone marrow can compensate, no anemia appears. It is called hemolytic state. Lifespan of red blood cell is about 120 days in healthy people. And in hemolytic anemia, red blood cells have a short lifespan. From different points of view, hemolytic anemia can be divided into different subgroups. According to the progress of hemolysis, it can be divided into acute and chronic anemia. According to the extent of hemolysis, it can be divided into mild and severe anemia. According to the site of hemolysis, it can be divided into intravascular and extravascular anemia. According to the etiology, it can be divided into inherited hemolytic anemia and acquired hemolytic anemia. According to the mechanism of hemolysis, whether the defect resides within the red blood cell itself or external to the red blood cell, it can be divided into intracorpuscular and extracorpuscular hemolytic anemia. Intracorpuscular and extracorpuscular classification is very important. It incorporates the patient history. It also allows the clinician to determine whether the hemolysis is reversible, whether transfused red blood cells will also be affected, and whether the treatment should be directed at a specific red blood cell defect or at another condition, such as an infection or drug. For intracorpuscular, it can also be divided into hereditary and acquired. Hereditary disease can affect structure and function of membrane, such as red blood cell membrane and underlying cytoskeleton, such as hereditary spherocytosis, hereditary elliptocytosis, and hereditary stomatocytosis. It can also be defects of enzymes that participate cell metabolism, such as erythrocyte glucose 6-phosphate dehydrogenase deficiency and pyruvate kinase. Hemoglobinopathies include sickle cell syndrome, thalassemia. Representative acquired hemolytic anemia is paroxysmal nocturnal hemoglobinuria. For extracorpuscular disease, there are also inherited disease, familial hemolytic uremic syndrome. The most common acquired extracorpuscular disease is autoimmune hemolytic anemia. It can also be caused by toxin, drugs, and infections, such as sigma toxin from E. coli, snake venom, drugs such as dapsone, penicillin, mesodopa, malaria infection. It can also be caused by mechanical destruction, such as microangiopathic hemolytic anemia, such as TTP, HLS, and DIC. Heart valve regurgitation or much hemoglobinuria. Clinical manifestations of hemolytic anemia depend on hemolytic site, extent, speed, and duration. Symptoms and signs of anemia is universal, such as fatigue, exercise intolerance, and congestive heart failure. Chronic hemolysis is mostly extravascular. Besides anemia, jaundice, splenomegaly, and hepatomegaly is usually apparent. Due to long-term hemolysis, some people have gallstone, that is, cholestasis. Hemolysis may suddenly get worse after infection. This is because individuals with chronic hemolysis are highly dependent on the accelerated production of new red blood cells by the bone marrow. Infections will impair red blood cell production in the bone marrow and thus diminish the capacity to compensate for chronic hemolysis. They can experience a rapid drop in hemoglobin level. The reticulocytes drop. Patients have anemia, leukopenia, and thrombocytopenia. And bone marrow is hypoplasia and have huge pronormoblast. This is called a plastic crisis. A commonly cited cause of transient aplastic crisis is parvovirus B19 infection. Other viral or bacterial infections may also cause transient aplasia. In acute hemolysis, especially intravascular hemolysis, people suffer from headache, vomiting, fever, pain on back and limbs, even acute renal failure and shock. And later, jaundice and anemia appears. Okay, that's all. Next class, we will talk about the laboratory findings of hemolytic anemia.